Following a spike in sudden cardiac deaths across Karnataka, especially in Hassan district, the state government has classified such incidents as a notifiable disease. Under the new directive announced by Health Minister Dinesh Gundurao, all sudden deaths occurring outside hospitals must be reported to the authorities and will be subject to mandatory autopsies. The Health Department, under Rao's leadership, is also implementing annual health screenings for all individuals aged 15 years and above, including school-going children. The objective is to identify congenital and lifestyle-related conditions early enough for timely medical intervention. In a related effort, a proposal has been sent to the Education Department to introduce a chapter on heart health, sudden cardiac arrest, and related medical emergencies in school textbooks from the next academic year. As part of statewide preventive measures, the government will also roll out cardiopulmonary resuscitation (CPR) training to the general public, aiming to improve immediate emergency response. Meanwhile, the Puneet Rajkumar Hridaya Jyoti scheme, currently active in 86 hospitals, will be expanded to taluk level government hospitals. Named in memory of the late Kannada actor, this scheme focuses on providing emergency care for cardiac arrest patients. An expert committee has attributed the increase in heart-related complications to COVID-19 infections, not vaccines. The virus has reportedly contributed to rising cases of diabetes, obesity, and hypertension. Clarifying remarks made earlier by Chief Minister Siddaramaiah, the Health Minister stated that the CM had only sought clarity about the potential side effects of the COVID vaccines. India, he noted, has not administered mRNA-based vaccines, which some foreign studies have loosely linked to mild myocarditis.
I had referred a matter which was there in public domain, and also a lot of discussions were happening on that regarding the impact of COVID and COVID vaccine on people's health, especially higher incidence of sudden deaths that were happening amongst younger people also. So he wanted a proper research and analysis done on that, and to give him a report. So a committee was constituted under the chairmanship of our Jaydeva director, Dr. Ravindranath, along with other experts from various different centers, and they have studied the matter, and they have come out with certain findings. And the reason, yes, there has been some increase in deaths due to heart attacks before COVID and since COVID. Now around 4 to 5% increase has been found, but that cannot be connected to either COVID or COVID vaccine. It is due to various factors, multi-factors, like higher incidence of BP and sugar, blood sugar, diabetes, and also obesity, and also smoking. Various risk factors, many risk factors are there. And the earlier, during COVID, there was some higher incidence of heart disease for the first 6 months to 1 year. Since then, after this 2-3 years has gone, that is very minimal. And as far as COVID vaccine goes, it is not. There is no negative impact of COVID vaccine as far as the sudden deaths and heart attacks go. There is no reason to believe. Worldwide research also is there. Research in India is there, and even our team also has done research, and whatever they have found is that there is no connection to COVID vaccine to any of these sudden deaths, and we cannot give that as a reason. So anyway, whatever is there, some issues, they have made many recommendations. So we have taken a few decisions from our department. One is as far as the sudden deaths go, which happen for people who are less than 45 years. So for any sudden death outside the hospital, when that happens, that should be notified. That will be made as a notifiable disease, notifiable incident, and that should be reported. And an autopsy will have to be done compulsorily for these kind of sudden deaths which have occurred outside the hospital, with no known causes or with very, with some symptoms, and within 24 hours somebody dies. So those kind of things, there has to be an autopsy done so that we should know why the person died. So that at least for further analysis on this will become helpful. So that is one decision that we have taken. Also, the main thing will be to screen our people and to find out early onset of these heart disease. So for that, for our school children who are in the 15th, who are in the 10th standard or 15 years old, we are proposing that we should have cardiac screening done, so that we can at least, if they are having any congenital heart disease or some early onset of heart disease, we can check and take precaution. Also, we will do screening programs across the state, that is with the government employees and other employees who are working with the government, to have at least once a year screening for heart, cancer, and of course basic screening should be done, whatever that is possible, so that we can at least know the status or the state of their health. So, and also we will be recommending to all institutions, other institutions, non-government institutions, companies, factories, all of them, to have a health screening program done in all their premises once a year.